to Deserve 2020, A Better Tomorrow Today virtual conference this year. Thank you for being here with us and joining us today.
Thank you for having me.
So we want you to tell the people watching and everyone watching who you are and just a little background of your title and what you do.
Okay, so my name is Katrina Howard. I am the lead communicable disease specialist for the Coastal Health District, which is also a part of the Georgia Department of Public Health. And so what I do is I surveillance communicable diseases in reference to HIV and AIDS, gonorrhea, chlamydia, and syphilis cases for our district. And I've been doing that now for almost 10 years.
So that's been a while. So tell us, prior to those 10 years, when did you know that this was the work for you, and why do you have a passion for it?
So I actually, I consider myself a baby of public health. My mom worked in public health for 36 years. So I ran the halls of health departments for many years. I can recall going to health fairs, playing, with the equipment and everything, and just not really knowing that this would be something that I birthed into today. I became really passionate when it hit home in reference to HIV with a family member of mine. So that allowed me to do more research, learn more about HIV and AIDS. So I could just help my family members. So who knew in 2020 I would have now been 10 years in. So I continue to do what I do. I'm passionate about it and I love it. So I'm all about helping people.
Why do you believe the conversation surrounding HIV prevention and care is still relevant?
I think it's really relevant, even more now. We've come a long ways when it comes to HIV and AIDS. And I do believe that we will be at a cure at some point. So now more than ever before, we need to push the conversations. We need to get the education out there. We need to educate our providers, our schools. I also believe that policies need to change so it can adapt more to what's needed with our care. So the conversation needs to go even more at this point. We don't need to stop it at all.
I certainly agree with that, and I think a lot of people sometimes, in different professions, not even just healthcare, but even specifically with this one, and with an election season just passing, it made me think about that a lot of times there's a lot you can do on the ground level, but policies and other things to affect change. Or when they don't change, they also kind of affect how things unfortunately stay the same sometimes.
Exactly.
And we don't, results aren't yielded. So I think that's an important part of that overall conversation too, from us one-on-one,
right,
and then in the community, and then our elected officials, the policymakers. That's a very strong point. And what are some things, like one thing that you believe or feel that every individual can do to stop HIV?
My motto is know your status, whether it's negative or positive. There is life outside of us after a status, after you find out your status. So I think if everybody would take that initiative to just go and do it, there's still fear from a test even. I find many people today getting their first test, even though they've been sexually active for many years. I think it should become a routine. It should be a common practice. So if everybody in this world would actually get a test, where would we be? I think it would be amazing. People can continue their life, know what they have to do, and move on, So that's my motto.
A great motto. It helps in a way then, routine checkups, just making it a part of your general health care. Then with that and other practices, do you feel that there's any real hope in reducing HIV numbers in the U.S., especially specifically in the South?
Yes, I do believe that there is hope. We are getting there now with the resources that we have available. PrEP is amazing. We just need to expand the resources for that. I believe there's hope for treatment. We're seeing more providers starting to expand into HIV care. There are benefits to even for providers going into our rural areas. So there's hope. I think we're doing it. We just need to go beyond that. I think there will be eventually a cure for that. So the rate that we're going now, we'll get there. I do believe in it, and I have hope that there will be zero numbers to new HIV infections at some point soon.
What are some other ways with this hope? How do you think we can make this hope a reality? What can people do, or even what more do you want to do or can you do that we can make this hope a reality?
I think that we need to stop looking at HIV and AIDS as a subject that's hush hush, something that we can't talk about. Continue to have those conversations. Our providers should be on board. Just like you get your testing for diabetes or high blood pressure, we need to make sure that we continue to have that a routine, not basing it off of a person's what they look like, or are they heterosexual or homosexual. You know, I should get my blood pressure the same as with my HIV. I shouldn't have to ask for an HIV test, and that makes sense. If we get to a point where this is normalized, I think that will get us where we need to be.
When you hear the phrase, I dream, speak, and receive victory, what first comes to your mind?
You know, I started to think about getting to zero. I think about 0 new infections, and what also comes to mind is 0 deaths. I think, I know there's hope when it comes to what we have now for HIV care, HIV prevention, and I just have hope that we're going to come to an end with this. There will be a cure, and I look forward to that day. Having somebody dear to me who passed away with HIV and AIDS, that was tough for our family. So I look forward to the day that no one will ever have to go through that again. And so that gives me hope to keep going.
Thank you so much for being here with us today and a part of this conference. We appreciate your information and your knowledge, and continue the work that you're doing.
Thank you, and thank you for the opportunity.